So what happens when you take a tooth out and you feel inside of the socket, I haven't raised a flap, remember, but I can feel inside my socket that I have a break or a fenestration in my buccal plate. In that situation, I'm not just going to place bone graft into the socket. I need to place something to be a barrier to exclude the epithelial cells that could come through that break in the bone. This is where we're going to occupy a membrane. So I've raised a tunneled a flap over the buccal plate. So now I've basically raised a flap full thickness on the buccal of this area. You can see my probe that's extending down to the fenestration. And in this case, it was mainly the mesial root that had this condition. So we have buccal plate damage. We're going to replace it with a buccal plate membrane. And that's the Helimend. And you can see how it stands up. So Helimend has memory. It wants to spring back to its previous shape. And that's different from some of the other membranes that we'll show you. This is a great membrane when you need something that can provide some structure to itself and can hold itself out. So now we've placed our bone graft inside. Here's our membrane. We've placed now over the top of our membrane, we're using a different kind of top of our socket. And this is a PRGF fibrin clot. So patient's blood was spun, and then we take out the healing proteins that occupy fibrin and growth factors, and you can condense those down and make kind of a homemade blood clot. And we place that on top of our socket, although we still have that buccal plate membrane that's acting as a new buccal wall. Here's what it looks like sutured, same suturing. We're not attempting primary closure on most of these sockets. We're allowing the tissue to migrate across. Here's what it looks like at 10 days. So what are we seeing here? Well, since we placed basically an autologous fibrin clot, we're basically seeing the remnants of fibrin at 10 days. And that fibrin is preparing, or it represents a scaffold into which cellular ingrowth can take place. You would see a very similar thing when we use a collagen type 1 dressing. It holds the space, it creates a stable blood clot. Once that stable blood clot has matured into granulation tissue, at that point, epithelium can migrate across and seal up the socket. At 6 weeks, we have our socket sealed, new epithelium that's grown in, covered our bone graft. And if we come back later at 5 months, now you see less of that. You don't see the rim as prominently, and now we have a nice mature bone underneath that we're able to place our implant into, etc.